Listen to me. If you are approaching 65, or if you are already retired and trying to navigate the minefield of health insurance, taxes, and medical bills, you need to pay attention right now. Healthcare in retirement is the single biggest expense that catches good, hardworking people off guard. You save your whole life in your 401k or traditional IRA, and then boom, medical bills, Medicare premiums, out-of-pocket costs start eating away at your nest egg. That brings us to one of the most powerful financial tools ever created, the High-Deductible Health Plan paired with a health savings account, or HSA. Now, I get asked this question all the time, Susie, should I have a high-deductible health plan and an HSA in retirement? Here is the truth. Before age 65, if you are working or retired early and you are relatively healthy, a high-deductible health plan with an HSA is a financial home run. Why? Because an HSA offers a triple tax advantage that no other account in the tax code gives you. Money goes in tax-free, it grows tax-free, and when you pull it out for qualified medical expenses, it comes out tax-free. It is better than a 401k. It is better than a Roth IRA for medical costs. If you are 55 or older, you even get to put in an extra $1,000 catch-up contribution every single year. You stack that money, invest it inside the HSA, and let it compound. But here is where people make massive, expensive mistakes that ruin their retirement planning. Listen to me very carefully. The moment you enroll in Medicare, whether it is Part A, Part B, Part C, or Part D, your right to contribute new money into an HSA stops immediately. The IRS rules are crystal clear: you cannot contribute to an HSA if you are enrolled in Medicare. Your contribution limit drops straight to zero. If you continue to put money into an HSA after you are on Medicare, the IRS will hit you with an excess contribution penalty, a 6% excise tax penalty every single year that money stays in there. And here is the hidden trap that catches so many pre-retirees, the 6-month retroactive rule. If you wait past age 65 to sign up for Medicare Part A because you are still working at your job, when you finally do apply for Medicare, Medicare Part A will backdate your enrollment up to 6 months retroactively. If you are still putting money into your HSA during those 6 months, guess what? You made illegal excess contributions, and you will face IRS tax penalties. So what is the rule? You must stop contributing to your HSA 6 full months before you apply for Medicare if you enroll after age 65. Now, does that mean your HSA is useless once you are on Medicare? Absolutely not. You cannot contribute new money, but you can spend every single dollar that is sitting in that HSA account tax-free. You can use your HSA funds to pay your Medicare Part B premiums, Part D drug premiums, and Medicare Advantage premiums. You can use it for copays, deductibles, dental care, vision care, hearing aids, and long-term care insurance premiums. The only big thing you cannot pay tax-free with an HSA is your Medigap policy premium. And after age 65, if you ever need money for something that isn't a medical expense, the 20% penalty for non-medical withdrawals disappears. You just pay ordinary income tax on it, exactly like a traditional IRA. So here is your actionable takeaway today: if you are under 65, maximize your HSA contributions and invest those dollars so they grow for your future. If you are turning 65 or planning to sign up for Medicare, map out your dates carefully. Turn off your HSA contributions at least 6 months before you enroll in Medicare Part A past 65 to protect yourself from IRS penalties. And once you are retired, use that accumulated HSA balance as a dedicated, tax-free medical bucket so you don't have to drain your retirement savings. Protect your money, stand in your truth, and make smart decisions for your financial freedom.